Other testing that we do are a little bit more invasive. They probably have to be done either in an endoscopy suite or a hospital. And so that would include things like upper endoscopy, where we take a fiber optic scope that's flexible, goes down your esophagus into the stomach. It allows us to evaluate the hiatal hernia, it allows us to take samples of the tissue in the stomach as well as in the esophagus. It can actually just kind of make the diagnosis of severe GERD. So if you find evidence of Barrett's esophagus, then we know you've had symptomatic GERD. If we find evidence of damage to the lining, which is what we call esophagitis, that's also easily picked up on an endoscopy. Sometimes when the endoscopy is done, we can leave a probe called a Bravo pH monitor, which is a little computer chip that basically sucks onto the lining of the esophagus, and it transmits information to a computer regarding the amount of acid that is coming up into the esophagus abnormally. And then we just basically put this in a program that'll tell us the amount of exposure your esophagus has had to acid over usually about a 48-hour time period. And depending on the amount of acid that comes up, you may fall into the category of having pathologic reflux.